Hello everyone, my name is Angelica Keene. I'm going to be presenting a conceptual map of Benner's nursing theory from novice to expert. Her full name is Patricia Benner, and she's the creator of the nursing theory named From Novice to Expert Nursing Theory. Some of the Benner's background is she was born in 1942 in Hampton, Virginia. She obtained her BSN from Pasadena Nursing College in 1964. Her master's degrees was obtained in medical surgical nursing from University of San Francisco in California in 1970. She obtained also her PhD from the University of California at Berkeley in 1982. And since 1982, she is working in research and teaching at the University of San Francisco School of Nursing. She has a vast history in research since the 1970s. Her philosophy is nursing is a caring practice guided by the art of moral and ethics of care that unfolds in relationship between nurses and patients. She's also an author of numerous publications and books, including From Novice to Expert, Nursing Pathways for Patient Safety, and The Primacy of Caring. What was happening in the world in the 1980s? Some of the things were happening is the rise of the new rights, the Berlin Wall was torn down, computer technologies emerged, the first AIDS cases reported in MMWR, HIV and AIDS was proliferated worldwide. The first medication for ACT for HIV is developed. The Reagan Revolution and Reaganomics was happening. Also, time period in nursing from 1960s to 1980s, when Patricia Benner was so much into research. In 1960, the American Nursing Association Committee recommended the baccalaureate as the basic degree for professional nursing practice. As we all know, a long-term goal for nurses is to have higher education for professional nursing practice, rather than having a diploma degree since early 20th century. In 1963, Public Health Services develops the Nursing Scientist Graduate Training Program. This was an initiative providing support for nursing research. In 1964, Nurse Training Act was enacted. This included nursing school grants, improvement and expansion of nursing programs, reimbursements of educational costs, and continuation of the professional nurses traineeship. In 1968, the Congress creates the National Center for Health Services Research. In 1971, extending the scope of nursing practice, Nurse Training Act passed. And in 1979, President Jimmy Carter signed the Nurse Training Act Amendment. In 1981, the Department of Health and Human Services publishes the recurrent shortage of registered nurses. They identify low salaries as the key factor for nursing shortage. In 1982, the American Academy of Nursing identifies 41 hospitals as magnet hospitals. In 1986, the National Center for Nursing Research is established as the National Institute of Health. As we're talking about Patricia Benner's From Novice to Expert theory, she was highly influenced by Dreyfus' model of skill acquisition and Virginia Henderson. Dr. Benner acknowledges her concepts in nursing had been influenced by this by Dreyfus' model. She adapted this model to encompass 5 levels of skill acquisition, including novice, beginner, competent, proficient, and expert. Benner's acknowledged Virginia's Henderson influence as well. Benner's theory consists of 5 stages in nursing experience, also known as stages of clinical confidence. This is a modern theory developed in the 1980s. Um, Her central concepts are those of competence, skill, acquisition, experience, clinical knowledge, and practical knowledge. Benner's domains in nursing practice includes the helping role, the teaching coaching function, the diagnostic and patient monitoring function, effectively management of rapidly changing situations, administering and monitoring therapeutic interventions and regimens, monitoring and ensuring the quality of health care practices, and organizational and work role competencies. How we apply our Benner's theory application. This theory can be applied to decrease CLABSIs in the hospitals. As we know, healthcare-associated infections account for an overall and annual direct medical cost of HAIs to the United States healthcare system. It's ranging from an estimated amount of 28 to 33 billion yearly. Benner asserts that excellent care practice are gained through a long-term experiential learning process with practical skills. She said also, also resulting collapses would cause prolonged, talking about decreasing collapses using Benner's theory, will improve to decrease prolonged hospitalization, use of antibiotics, putting patients at risk of sepsis, and increasing mortality rate. Continuing education is an ongoing process. Every day we have healthcare updates with new evidence-based practice research that all nurses must be aware of to provide a safe patient care, nursing care. The experienced nurses should mentor new nurses to deliver safe and effective care of central lines, so they can not only know that, but know how, therefore preventing collapses. Thank you. And these are my references.